Dr. McDonald, first of all, just tell us overall, I know there was some bumps in the road, but how you think the first day of signups for the 65 plus crowd went yesterday, especially, older folks using computers for the most part to try to do this and click on and try to find that elusive appointment.
Yeah, it's working pretty well. I think we're very excited that we're in the 65 and older group right now. I'm really excited about the momentum we have. It's a whole different feeling this week than it was last week. And it's interesting, you talk about maybe our elders can't navigate the computer as well. But when I looked at the 75 and older crowd, more than 90% were doing this online. So that's good to have the phone option, but they're showing us they know how to work that computer, and that's good for us.
I know I heard from some people it was a little bit frustrating, trying to get appointments and stuff like that. I know that's going to happen. What do you say to those folks? I know your pearls of wisdom.
Yeah, in the beginning, there's a lot more demand than there is supply. And I think it's one of those things where we just opened up and it's a little bit like there's a lot of demand right now. But if you stay with it, over the next few days, you're gonna see more appointments coming and it's gonna help people get what they need. And I think that's where it's just be patient, stick with it every day, and you're gonna find there's more appointments. I'm optimistic about our future. I see more vaccine coming us eventually, and I see more appointments coming very soon after. The state sites in particular, and the municipality sites have really got a lot of capacity and they've done really well with this. They've really moved a lot of people through very efficiently, but very safely. And I think that's an important point is, really what we're trying to do is have a quality healthcare experience here. In other words, you're going to get the right vaccine for you. It's going to be given to you safely. We know it's been stored appropriately, and we know you're going to be given to it in a nice way. And people come through the system have been very happy with what they've seen so far. The sites I've seen have been very efficient looking, and I like what I see too.
It sounds like a lot of people are getting the vaccine per day. And I know I've asked Dr. Alexander Scott about this and Joseph about this, about, there was the criticism of the rollout being slow, and did that mean there was leftover or now some sort of surplus of vaccine? Is there more than what we got for the week that's now in the system to kind of give it a boost this week, or no? Is that a misinterpretation of the numbers?
Yeah, I don't know that there's more. I think what we found is that there was some that was sort of held, in distribution, and now it's here. So it's getting into the system quicker. One of the things I really see is the amount of time between when a vaccine gets into the state and gets into someone's arm is really shrinking quite a bit. And that's helping people get more vaccine more quickly. And, right now I'm very happy with what I see. Saturday, 9,000 people got a vaccine dose. We're averaging a little over 6,200 a day right now. And I think that's going to increase soon. So I'm optimistic. There's a lot of momentum right now. You're seeing this thing really snowball in the right direction. And we need people to keep doing that. It's exciting right now.
Do you think the criticism was unfair? That this rollout was slow, or it didn't get to the 65 and older eligibility fast enough?
We're during a difficult time. People have a lot of stress. The pandemic caused pain every day to everybody. Every day you have a little bit of pain from the pandemic. So if people need to blow off a little steam and vent their stress, Department of Health can handle it. We're okay with that. I think what people didn't really understand is what was the strategy. The strategy was those who are in nursing homes, most vulnerable to assisted living, and then the occupations we need. I don't think people are really clear on the strategy, but I don't think you can argue with the results. When you look at our decrease in hospitalizations compared to other states, much higher. When you look at our decrease in cases among healthcare workers, nursing home residents, really profound decreases. So I think people, once they understand the strategy and see the results, you just can't argue with the results. They're very positive right now.
Dr. I hear you on that, the hospitalizations and the percent positive way down. I know the death number, though, still remains high. And I think the CDC may have it as the highest per capita in the country for the last week. What do you say about that? Why is that still the case?
Well, the fatality numbers are actually coming down. When I look at the crude death rate and the fatality rate, it's still pretty low. In other words, our fatality rate right now is less than 1.4%, which is pretty good and on par with other states or even a little bit lower. And we're heading in that direction. You're going to see that drop even further. I was just looking at some data from a meeting. The death rate is still dropping and will continue to drop. One of the things you're going to be seeing is decreases even more in hospitalizations, I think. One of the things that was interesting last night, for the first time in as long as I can remember, we only had single-digit people admitted to a hospital. We only had 4 people admitted to a hospital last night. Quite frankly, that was one of the things I had to call the data team and double check that number. We only had 4 people in the whole state admitted to a hospital last night with COVID. That's a new space for us. We've been in double digits for a long, long time. And one of the things I'm starting to see is that you're really seeing positive effects from all the strategy we're doing. It's not vaccination by itself. It's people getting treated with monoclonal antibody. It's people having the public health measures and adhering to them. And we're just having a lot less cases. So really, when you look at the whole response, it's really moving in the right direction right now. We're well positioned to withstand the threat of the variant, which is what we needed to be.
How bad could that be? Is the modeling telling you anything about hospitalizations or case numbers, or at this point, would you have already expected it to be on the rise?
No, the variant is still a threat. The variant is still a real threat, but it's within our control. Like, we have all the tools we need to contain the variant. If you don't have a high quality mask, I have one right here. This is a KF94, but I highly encourage everyone to get a KN95 or a KF94, a nice high quality mask. It's a better mask than what you've been using. Cloth mask is okay. Double masking's better, but this is really the best approach, is to use a high quality mask. And people know to stay 6 feet apart. They know not to congregate with each other. And we have vaccine that we're rolling out like crazy. And we have plenty of treatment with the monoclonal antibody. So we have all the tools we need to contain and beat the variant. A lot of people talk about the variant overwhelming their state in 90 days. I don't know any general that concedes ground to the enemy without a good fight. And I am not conceding that ground to our enemy without a strong fight. I know Rhode Island can beat this variant. I know we're going to beat the pandemic, but we have all the tools we need to succeed right now.
Just to go backwards, I know you said with the hospitalizations number down, and not to harp on the negative, but the death number, is that still a lot in the nursing homes and congregate care settings, or where are those numbers still coming from in terms of the fatalities?
You're gonna have to ask Joe that, because I don't have it, because the deaths have been so few. We're just not seeing that many deaths right now. The mortality rates are dropping. There was a report yesterday from some data from November and December that we had to catch up with, but that was old data that we caught in an audit. For the most part, though, our death rates are going down, and I'm not seeing a lot of nursing home cases. Like, one of the things I see in nursing homes that really excites me is we are lower in cases in nursing homes than we've been since March. That's pretty dramatic, and that's a vaccine effect, and I think that's pretty cool.
And back to the vaccine, and you said, you obviously expect more doses to come in. Is there a point at which it'll be really easy and no wait for somebody who's 65 plus to log on and get an appointment without having to check back in a few days? And do you expect a time where there really won't be a wait or a backlog of people trying to get the vaccine once the age group opens?
Yeah, I absolutely do. And I think it's hard to say when that will be, but in the coming weeks, they're going to think I think you're going to see in the coming weeks, it's going to be much easier to get a vaccine, and there's not going to be a long wait time, because as our supply increases and less people need the vaccine, I think you're going to see that happening. I think it's going to be in the coming weeks, though.
Anything else you'd like to add that you think is important going on right now?
One thing I don't think people have really appreciated in the pandemic is the positive health impact of all our public health measures. So I had a very interesting conversation yesterday about Hasbro. The census is down at Hasbro. Can I tell you, I'm pretty excited that we don't have kids in the hospital right now. There's some, but their census is down. Usually during cold and flu season, children's hospitals are bursting at the seams, but they're not. That's got a lot to do with our positive public health measures. By the way, we aren't even seeing flu anymore in Rhode Island. I think that's a positive as well. We normally be in the peak of flu season by now. Right now, there's almost no flu. There's a lot to be happy about right now. One of the things I'm also seeing is I'm seeing doctors who normally take care of sick kids a little bit bored because they don't have that many sick kids. I'm hearing ear, nose, and throat doctors who put tonsils and put tubes in are like, I don't have any patients to put tubes in their ears because they don't get ear infections. So there's a lot of positive public health things that are happening. And it makes me wonder if in future winters, maybe a lot of us will wear masks just because we think it's a good idea, not because we have to.
Well, I was going to say, Dr. Fauci mentioned something about potentially wearing masks next year. And now you're right. I think a lot of people I don't want to jinx it, but even myself included, I'm usually good for 2 colds a year, and that hasn't happened. And so you wonder, is it because we're doing all these things? But do you think there's going to be an ongoing appetite? And I know in other parts of the world, they wear masks and did wear masks before. Do you really think there's an appetite for that going forward once this is over? People are going to be, I got the vaccine, my family's got the vaccine, I'm done.
Yeah, it's interesting. It's a cultural thing. I used to live in Okinawa, Japan, and in Japan, if anyone was sick, they always wore a mask when they went outside. I think that'll be something that might be part of our culture now in the Western culture, is people wearing a mask when they've got a cold, or maybe staying home, which would be even better. I think one of the things you might see more of, by the way, too, is when healthcare workers are seeing people who are ill, I think they might wear a mask where they normally didn't in the past, because people don't want to get sick anymore. I'll tell you this, I can't remember the last time I got sick. And I'm working like a dog, and I can't remember the last time I was sick. I think that's a bonus.
All right, let's not jinx ourselves, but it was good talking to you, Doctor. And
Thank you, Brian.
I guess we'll see you next week too, hopefully. So
I look forward to it. You have a great day.
all right, you too.